Statin, we know it is the medications used to lower lipids. In our body, we have two important types of lipid. The good lipid, which is called as the high-density lipoprotein, and the bad lipid, which is the low-density lipoprotein. Accumulation of excessive LDL, bad lipid, in our blood vessel can result to narrowing of this blood vessel, forming what is called as atheromatosis plaque, and the process called atherosclerosis. This process mainly affecting the cerebral blood circulation, and it may result to transient ischemic attack or stroke. It may affect the coronaries, causing ischemic heart disease, may affect peripheral vessel, causing peripheral artery disease, and so on. Our target to protect vessel from this process of atherosclerosis, to lower the bad lipid, the LDL, and increase the level of HDL. These lipids are synthesized in the liver by certain chemical processing, and statin work here. It inhibits this process and decrease the level of LDL to the safest level. At the same time, it have a modest elevation of the level of HDL. So it lower the bad level and increase the lower the bad lipid, and increase the level of the good lipid. So it protects our blood vessel from the process of atherosclerosis. It is a widely used medications. I told our patient it is a safe drugs. It is widely prescribed, and it should be prescribed for every patient with documented atherosclerosis to protect your vessel from a next events. You may notice a simple side effects like muscle pain, some nausea, some sleep disturbances, but it is very limited side effects, and the serious side effects is very limited, very extremely rare, and it can be avoided. Heart failure is one of the most common health problems we notice in our daily practice, and the pharmacological treatment of heart failure depend mainly on the type of heart failure. We have mainly two types of heart failure with a preserved ejection fraction and heart failure with reduced ejection fraction. Heart failure with the preserved ejection fraction, the treatment mainly depend on the treatment of underlying pathologies and risk factors: hypertension, diabetes, ischemic heart disease, obesity, atrial fibrillation, and the only drugs till now proved to improve survival in such patients is the SGLT2 inhibitors, the empagliflozin, depending on a large trial, the DELIVER trial, and empagliflozin, depending on result of EMPEROR preserved trial. For patients with heart failure with reduced ejection fraction, as much as possible, I try to prescribe all the four pillars, which are the drugs that improve survival in patients with heart failure with reduced ejection fraction, in addition to medication that reduce symptom of the patient, like diuretics. The four pillars including ACE and ARBs, and preferably ARNI, beta blockers, aldosterone antagonist, and SGLT2 inhibitors. Which drug to start first and how to combine this medication, this depend on the patient factors. For example, depend on the NIHA class of the patient, depending on the symptom of the patient, frailty, age, any associated comorbidities like diabetes, renal impairment, and so on. For example, if we face a patient with angina, rapid heart rate, high blood pressure, and heart failure, I may start with ARNI, beta blockers, aldosterone antagonist, and in the next visit, I may add SGLT2 inhibitors, and so on. If the patient is already diabetic, I may start with ARNI, SGLT2 inhibitors, and add in the next visit beta blockers, and so on. At the end, I will try my best to prescribe the four pillars that improve survival for such patients. When we receiving a patient to emergency department or clinic with chest pain, sometimes the initial investigation is not conclusive for the diagnosis of this chest pain. Chest pain, as we all know, it may indicate something simple, and sometimes it may carry very serious illness. So for such patient, we go further analysis of his chest pain, regarding the site, character, onset, radiation of his chest pain. For example, a patient with rapid onset chest pain, severe in nature, crushing chest pain, squeezing chest pain, radiated to shoulders, to the jaw, it may indicate the presence of acute coronary syndrome. If the chest pain is simple for longer duration, pricking in nature, no specific radiation, it may simply indicate non-serious conditions like musculoskeletal pain or so on. Also, we depend on the presence of risk factors. Of course, we get more attention to patients with risk factors like hypertension, diabetes, previous ischemic heart disease, if the patient is already a smoker, if the patient was obese and have sedentary life. All this, we should pay more attention to such patient on assessing their chest pain. Also, examination result is important regarding the vital signs, presence of abnormal cardiac sound, abnormal murmurs, basal crackles, and so on, and depend on investigations. ECG, even if the initial ECG is negative and not conclusive, we should repeat the ECG every 3 minutes because the changes may appear later on. Cardiac troponin, and we assess the change in the level of cardiac troponin because also the initial result may be negative and not conclusive. So for the patients with typical chest pain suggestive of ischemic heart disease, we should keep the patient, repeat examination frequently, repeat ECG frequently, repeat cardiac enzymes frequently, till we make sure either he is significant chest pain and require further management, or everything remain normal and we discharge the patient. Heart rate means how fast the heart is beating, and it is expressed per minute. The usual heart rate is 60 to 100 beats per minute. But this is not a fixed number. Sometimes our heart normally beats less than 60 if we don't need energy for this heart rate, for example, during sleep. And sometimes heart beating more than 100, for example, during exercise, because we need this increase in the physiological demand. All this is regarded as sinus tachycardia or sinus bradycardia. But sometimes slowing heart rate or more rapid heart rate may indicate underlying pathology. For example, lowering heart rate, it may indicate some systemic or cardiac disease like heart block, myocardial infarction, hypothyroidism, hypothermia, increase in intracranial pressure, and so on. So this should be investigated well and should be tested well, ECG, blood test, and others. And at the same time, also a rapid heart rate, not necessarily it is normal. Sometimes it indicates underlying pathologies like heart failure, myocardial infarction, thyrotoxicosis, and so on. Heart rhythm is how the heart beating. The normal rhythm, our heart, the time interval between beat and beat should be fixed. This is called as a regular rhythm. If the time interval between beat and beat is not fixed, this is called as irregular heart rhythm. Our heart normally should be regular, whatever the rate, but it should be regular at a fixed interval. Irregular heart rate, it may indicate rhythm abnormality, which may indicate sometimes simple things like ectopic beat or missed beat. We feel a dropped beat. And sometimes it may indicate a serious pathologies like atrial fibrillation or other types of arrhythmia.
So when it matters most, choose Denk Pharma for your health and the health of your loved ones. Denk Pharma, quality for your health, made in Germany.